Hey everyone, my name is Jonah. Today we are going to go over Alaris pumps. In doing so, we are going to discuss primary fluids, secondary fluids, and maintenance fluids and how they all differ. We are also going to discuss how to electronically set up our pump with our medicine or what have you with the patient's record versus having to manually set it up in case there's some sort of technological error. And then the last thing we're going to discuss is how to verify the patient's safety checks, such as right patient, right dose, right route, right time, right medicine. And then in doing so, we're also going to discuss verifying that what you're giving as a medicine is compatible with any other fluids that the patient needs. All right, so first let's discuss maintenance fluids. Maintenance fluids are those that are ordered by the physician, provider. They're meant to be going into the patient's vein via the IV nonstop until the provider discontinues the order. So think of maintenance fluids such as like normal saline or lactated ringers or dextrose 5% with half normal saline mixed. Anything that has an order with a rate attached to it in their medication administration record or their MAR, that is going to be a maintenance fluid. So then when we're discussing primary and secondary fluids, sometimes people interchange maintenance fluids with primary fluids. I like to just think of primary fluids and secondary fluids as their own thing. So with a primary fluid, even though I have this 500 milliliter bag of normal saline versus this 1,000 milliliter bag normal saline, I like to think of this smaller bag as my primary fluid. The reason is because when you have a primary bag of fluid, you have a secondary bag. A secondary bag of fluid is typically an antibiotic or something else that the provider has ordered as medicine that needs to go into their vein, and we call it an IV piggyback because it needs to be sitting higher than the primary fluid. So think of it as like literally being piggybacked onto the flush bag. Flush bag is what I like to call a primary fluid in this case because we're literally just using this primary bag to flush any extra medicine through. If you have a maintenance fluid and you have a separate channel and you also need a primary and secondary set, it does not matter where this one is positioned on the pole because it's going to have its own channel. However, if we're using just one channel, a primary and secondary, because of IV medicine, we need to have the secondary above the primary. Something else to note, you'll know that your medicine that is supposed to be a secondary fluid is a secondary fluid because it's going to be an antibiotic or some other replenishment therapy like potassium chloride. Let's say it's Zosyn, an antibiotic. It's going to be every 8 hours or sometimes every 6 hours, but you're going to see it in their medication administration record, and it's going to say IV as the route, and it's going to be a set interval of every 8 hours, every 6, every 12, something like that. First, we're going to make sure that we have clean gloves on after we do hand hygiene details. So with a primary set, it's going to be very long. It's going to have one of these little blue pieces in there. And then secondary set, it's very small. They also say primary and secondary. Primary set, you're going to use it with your big primary or continuous fluids, or you're going to use it with your flush bag. The secondary set, always only use it for the actual secondary medicine. So every time that you take your primary set out of the bag, immediately close the clamp. This is going to come in handy later, as we'll discuss. I like to also take all these little extra tidbits off. Now that I've got all the stuff off of my tubing, I'm going to spike the bag. You can do this a bunch of different ways. Once you pull off this little cap here, some people, they like to invert it, the bag. They like to spike it downwards. This isn't going to come out until I actually spike it, so I'm just going to do it up here. And you like to do a little twist motion, get it in there. And notice how there's no fluid coming into the chamber because I have my clamp on. This is what I was talking about earlier. It's important because whenever you clamp this is going to prevent any air from just going in with the fluid and not having any control over the fluid going into the chamber and through the tubing. Now that I have it clamped, I'm going to squeeze the chamber a couple times, make sure that the fluid is about halfway full. And now I have less risk for any air bubbles getting trapped in the tubing and making the pump not work. Also, you don't want to inject air into the patient's vein. That is also very bad. So next we're going to release the clamp. You're gonna see the fluid start to drip, and we're gonna prime our tubing. Next, we're gonna go over how to actually set up the Alaris pump. So we're gonna power it on. It's gonna do a little beep. It's gonna program, take a few seconds. And after this, we're also gonna learn how to get into the patient's MAR. And for HIPAA purposes, we have a fake patient. We have a list of fake patients we can use for educational purposes. So yeah, now that our pump is on, we're going to select new patient, yes. And we're gonna confirm that this is a patient profile, yes. So now we are in. It'll always have a little run time of the battery without it being plugged in. Another extra little safety feature because you don't want that thing running out, so don't forget to plug in your pump. So we are in the room. We are going to ask our patient to verify their name and date of birth. They're gonna verbally respond to us with the right name and right date of birth, and we're gonna cross-match that with what's on their armband. And then once we have all that, we are going to scan their armband. So scan it. I don't actually have the armband, unfortunately, so I'm just gonna simulate that by clicking next, and there's no scanner. But now we are loaded into their MAR. So what's interesting is if you were in the wrong room, but you have this patient up that's not that patient, when you scan their armband, it's not gonna let you see this MAR. It's not gonna pop up. So it's an extra safety feature to be aware of. So that's what's nice about the scanner. But yeah, once we're in here, we see our continuous normal saline of 1,000 milliliters of our dose. It's supposed to be going at the rate of 125 mLs per hour. If it dots off like that and you want more information, just hover over it and that little text box is gonna show you what you're missing. So yeah, now we are ready to scan. I'm going to do so by scanning the barcode right here. And nothing on the pump happens because this little text box is what's gonna pop up on the screen. So now again, we can verify right medicine or fluid or drug or what have you, right dose, right route. Right here is what we're gonna verify our right route. The right time it's supposed to start now. And then once we get all of that plugged in, let's say that he has a right AC IV. Now we verified everything patient safety check wise. We're ready to start our fluid. So we're gonna hit program and notice it says ready to scan pump. So now I'm gonna go ahead over here and see that little barcode right there. Scan that. And the scanner is connected to our chart in the computer and it is able to set up our fluid for programming. So now I'm ready to plug in my tubing to the channel. If this beeping's going on and you don't want it to go on, just hit silence. So, ready to start our continuous fluids here. Get it untangled. Still make sure that you're trying to keep this as clean as possible. Don't just let it hit anything. You're gonna load it in here on the top. And then you're gonna take this little extended portion and there's this little groove right down here. I'm gonna silence that again. There's this little groove right here. You're gonna slide it in. It's gonna start beeping. Close the door and boom. So now we have our maintenance fluid loaded. I'm going to release this clamp because now that I've loaded it in here, there's an extra little clamp that is keeping the fluid from just spewing out of our tube. We need to flush the patient's IV with a 10 milliliter syringe of normal saline, make sure the IV is actually working. And then I'm going to take off this little cap and I'm going to connect it to the patient's IV and then I will hit restart and we're good to go. Now, once you have the maintenance fluid connected to their IV, you're gonna hit restart. You're gonna come back to your computer and you're going to see that it says confirmed pump infusing. You're good to hit okay. And then you can sign and chart off that you have started your maintenance fluids. Now let's go over primary and secondary tubing. So we are going to set up our flush bag just as we went over with our maintenance fluid. You would spike the bag, making sure that it's clamped first, squeeze in some of the fluid into the chamber, and then you would prime all your tubing just as we did with this one. So I'm gonna go take care of that real quick earlier. And as you can see, I have now spiked my flush bag because I have a secondary bag of magnesium sulfate. So that is our patient's intermittent medication that needs to go into their IV. I need to spike that and get that ready. However, what I like to do is I like to just take it and connect it to the port that is up here above the channel itself. So I will screw that on. I'm gonna unclamp my tubing. And then I'm holding it below this bag and I'm gonna grab the camera real quick. You can see that now it's filling up because I have it lower than the bag. So I'm back priming with normal saline, my flush bag. So I'm back priming the tubing. My tubing's all good to go. I don't need to clamp because I now am holding this tubing above the flush bag. You see how gravity is not letting any more saline come up, it's staying at this level. So what I'm gonna do is take off this little cap of our magnesium sulfate, and I'm going to spike it like so. No medicine's gonna come out because it needs to be spiked first. And now we're all set up with our primary and secondary tubing, and now we can go through the steps of setting up a primary and secondary bag. Now, per IU health policies, you'll see that there's no flush bag ordered here, there's just continuous. So what we would do is we would go to orders and we would hit plus add, and you would search flush bag on the computer. So you'd search flush and you'd see a little option pop up and you would order those flush fluids. I would choose, in this instance, a 500 ml bag of normal saline as my flush bag. And then you would order that via your provider that is taking care of that patient for the day, and you would hit that it is per policy. Now, once we order that, we would refresh our MAR and you would see it pop up here, and we would scan the bag in. And what you would notice in that circumstance that is very odd is whenever you have a flush bag scanned in, it's gonna say that you want to infuse all 500 milliliters of the bag at a rate of, I think, like 50 milliliters per hour. We're gonna change that though. Here, we're gonna say basic infusion. And we're just gonna say, based off of our magnesium sulfate, it's supposed to run at 25 milliliters per hour, as you can see. I want to start the rate of the flush bag, that's our primary infusion, at 25 milliliters per hour. And then volume to be infused, I've done a little bit of research and I've also tested this out myself. In all of this tubing, 25 milliliters at least of fluid is going to be going through that tubing. So I'm going to say I want at least 25 milliliters to be infused. And then we're gonna hit start, and then we're gonna hit pause because we're not done yet. We need to set up our secondary infusion. One last time, we are going to verify that our primary bag is hung lower than our secondary bag via our little hook here. And that ensures that the secondary medicine is going to infuse to our patient's IV. So now we have our primary flush bag waiting to be going. That is because we need to set up our secondary fluid. So as you can see, we need magnesium sulfate scanned in. I don't have the magnesium sulfate because I don't want to waste any medicine. So what I'm going to do is I'm going to click on just one of these boxes. Let's say it's this one. And I don't have a scan. Why am I doing this? Because I don't have a scanner. Let's say that. And now our text box appears as if I were to scan the actual barcode itself. This is what would pop up. Again, we're gonna verify right patient name, date of birth. We're gonna verify it's the right drug, it's magnesium sulfate. It's the right dose. It's gonna be going at 25 milliliters per hour. There's our right rate. Now we need to click the right route. It is going through their IV into their right anacube fossa. And once again, we are ready to program. Now, let's say that computer is not working and we need to get our medicine going anyway. We can't scan it in because it's not working. What you need to do is know how to manually program the IV pump. So what we would do is hit channel select. We know that it's this channel because everything's connected and it's going together in this channel. So hit channel select. I'm gonna hit the silence button. And you're gonna wonder, what do we do here? If you look down here and read on the screen, you'll see secondary. So we need to hit the little arrow that says up there to secondary. Now we have all these medicines pop up. There's a little alphabetical list here. We're gonna go to K through O because we need magnesium sulfate. Once we do that, we need to go to M. And if you needed to scroll down on the page, you could do page down, go back to page up because magnesium sulfate's up top. So I'm gonna select that. I'm going to verify that our dose is in grams, 2 grams. I'm gonna hit dosing in grams. It's 2 grams and 50 milliliters. So 2 grams, 50 milliliters. Is this the correct selection? Yes. It has all this information popped up. What it doesn't know is how fast it's supposed to go. We do know it's supposed to go at 25 milliliters per hour, as we can see right there on the middle of the screen. So I'm gonna hit 25, see how it's not letting me. So how fast is this supposed to go in? Or over what time? I'm gonna exit out of here real quick. And I'm gonna hover over this, and it says infuse over 2 hours. You see that? So we're going to select duration. It always starts at the minute section, so we're gonna do 2 hours and then 0, 0. So 2 hours, 0 minutes. Then our rate pops up for us, 25 milliliters per hour. We're going to hit start. And we're going to confirm that the clamp is open. And we're gonna hit pause real quick because what we need to do is flush the patient's IV line and make sure that it's working properly. Now we're going to connect the hub right here to the cap on the patient's IV, and we're going to verify that our clamps are open. Clamps are open. And once we've done that, we're gonna hit restart, and we're going. So IU Health has a nice access to micromedics, which is how we would check IV compatibility with fluids and drugs. So use whatever your institution has. Also consult your pharmacist if the search doesn't pop up anything that you actually need it to or doesn't tell you. But let's say, like with our patient, we have magnesium sulfate as our drug. But let's say instead of normal saline that he would have as continuous fluid, running with his primary and secondary fluids, let's say we actually have D5 half normal saline. Let's find that one. D5 half normal saline. So now we're checking the compatibility of magnesium sulfate and D5 half normal saline. And we're gonna let it load. And look at that, it says not tested. What I would do in this situation is I would contact my pharmacist and see if it's truly not been tested. If it hasn't, then we would need to start a second line because we don't want the fluid to not actually infuse or for the tubing to malfunction, crystallize, anything like that. So that is the purpose of checking your compatibility with your medicine and your fluids. And then there's this thing up here called iAware that IU Health uses. It's a very interesting application that because whenever the scanner does work with technology, when you scan it into the pump from the patient's chart, it will actually go into their I&O flow sheet over here. It'll go into their intake and output. Doctors love to know what fluids are going in, what's coming out. So when we click on iAware and we load that in, let's get it a second. You'll see over here, it'll say what all has infused so far. This was the normal saline that we had just started and scanned in because we had the scanner working. But it was saying what rate it was going at, and then after so long, it'll pop up and say how much milliliters was actually infused. So iAware is nice because you would click and drag on everything that was infused. You would hit the little check mark over here and it would populate into their intake and output. So that way doctors can actually know how much fluid they're getting and how much they're excreting. And that sums up how to use the Alaris pump with a scanner or how to manually input any kind of medicine that you need. Now we're just gonna go over some questions detailing what we've just learned. So first up, when we have a patient getting antibiotic Zosyn every 8 hours as a secondary medicine, how would we hook that up? We would ensure the antibiotic has a flush bag accompanying it as shown right here. And we would ensure that the secondary antibiotic is hanging higher than the flush bag. Next, why is the scanner beneficial for hospital use? It actually acts as a double check to verify that we actually have the right patient. The scanner allows for smoother programming, as you saw. It's not as clunky and it actually knows the rate and the dose and everything on its own because it's connecting from the computer to the pump. And also it connects the fluids to iAware, as we just saw, because now the doctor can see that we have the most accurate intake. Now let's say that we have a patient that has D5LR going and the physician orders ampicillin sulbactam every 12 hours as a secondary antibiotic. What would you do exactly in this situation based on these provided answers? if you chose correctly, you would actually check with pharmacy or check with your drug reference guide that we have, the micromedics. You would check the compatibility of fluids. This way we can determine if we need to start another IV or if the fluids can go in together safely. You should always clamp the tubing, whether primary or secondary, before you start spiking the bag and priming the tubing. Is this true or false? This is true because it will enable us to control the priming of the tubing. Once we have spiked it, it will allow for less air bubbles to get in, and allowing less air bubbles means that the pump's actually going to work. If there were too many air bubbles or there was a big air bubble, the pump would not work and you'd have to keep on priming the tubing until that air bubble gets out. Last up, once we've primed all of our tubing and programmed the Alaris pump, we would immediately connect the IV tubing to the patient and start the infusion and leave the room. This is actually false. First, you would unclamp all of the lines, then you would flush the patient's IV, make sure that it's actually patent, still working, and then we would make sure everything is unclamped, we connected it, and we would make sure that our medicine or our infusion is dripping into the chamber that is supposed to be going, whether it's secondary or if it's a primary maintenance fluid. So that concludes the lesson for today. Hopefully you learned something, or hopefully this was a nice rebrief on everything that you learned in school. And just remember to follow what institutional policies your hospital has for you.